Welcome to the Women and Infant Center at HSHS St. John's Hospital. The Women and Infant Center is located at 415 North 9th Street in Springfield, Illinois, in the Carol Jovecki Women and Children's Center. This tour will show the facility, as well as review the process of birth, delivery, and postpartum care. There is a circle drive in front of the building. This is our drop-off zone. Once inside the lobby, you and your visitors will check in at the information desk. After checking in, visitors are given a visitor sticker, which gives them access to a birthing unit. The Women and Infant Center is located on the 3rd floor. After getting off the elevator, you will pick up the phone on the right side of the door to speak to the receptionist, who will let you in the locked unit. The door is locked to ensure a safe environment for mothers and their babies. Once inside, the staff will discuss our visiting policy and guidelines with you. The hospital will provide almost everything you need during your stay. The only thing you need to bring are something for you and your baby to wear home. However, you are welcome to pack a bag with personal belongings for you and your baby. St. John's Hospital offers several prenatal classes to prepare you and your support person for the birth of your baby. A list of our classes can be found on our website, st-johns.org, under Classes and Events. Registration is required. As you near your due date, it is common to have questions and concerns. Before coming to the hospital, we highly recommend calling the Women and Infant Center to speak with one of our registered nurses, who can answer your questions, discuss your concerns, and determine if it is time to come to the hospital. The number is 217-544-6464, extension 30300. Most moms will start in the triage area for an initial assessment. The triage nurse will begin by asking, "What brings you in today?" The medical team will evaluate you and determine if you should be admitted to labor and delivery or the antenatal unit. The time you spend in triage varies. It depends on how long it takes the team to decide if admission is needed and to answer all of your questions. After triage, you will either be discharged home or admitted to the hospital. You may be thinking, what is antenatal? Antenatal is our inpatient area for women who are experiencing a high-risk pregnancy or are having pregnancy complications that require hospitalization. All 12 antenatal rooms are private rooms with private restrooms. These rooms have flat-screen TVs with access to educational materials and DVD players. Each room has a couch that can be converted into a bed for your support person. We provide all linens and pillows needed. The lighting and temperature are completely under your control to make you as comfortable as possible. Now we are in labor and delivery. This is where you will finally meet your baby. Once you're admitted, you will meet your care team, a primary RN, an attending doctor, and a resident doctor. The options available for women interested in medication for pain control are IV pain medication, nitrous oxide, or an epidural. Women are welcome to use these methods to control their labor pain as long as they don't negatively impact the mother or baby's health. Anesthesiologists and certified registered nurse anesthetists are available around the clock to discuss concerns and answer your questions. As a reminder, you are no longer able to get out of bed and walk around after receiving an epidural. For women who desire natural labor without medication, we offer a squatting bar, birthing balls, an inflatable birthing stool, mirrors, rocking chairs, and the labor bed itself can move into various labor positions. We also have a telemetry device that allows you to walk around during labor while we continue to monitor your baby. In fact, all maternal and fetal monitoring is connected to a central monitor at each nurse's station, so the care team knows exactly what is going on with you and your baby at all times. We do not provide diffusers or essential oils for aromatherapy or massage, but you may bring these in and use during labor if you desire. All methods of pain control should be discussed with your medical team. If they believe something puts you or your baby at risk, they may recommend different options. All of the bathrooms in the labor and delivery rooms have a shower with a seat and a handheld shower head. One labor room has a tub that can be used for labor. However, you must have a certified doula with you to use this tub. You are welcome to labor in the tub with a certified doula, but once you are ready to give birth, you will be moved to a bed for delivery, as St. John's Hospital does not offer water births. In addition to your care team, there will be a nurse and possibly a neonatal team present at the time of your infant's birth to assist with the baby. Once your baby is born and everything is stable with mom and baby, skin-to-skin contact on mom's bare chest is highly recommended, especially the first hour after birth. This helps with initiating breastfeeding, maintaining a normal body temperature, and glucose levels, while the baby transitions to his or her new surroundings. This is an amazing bonding experience. The initial infant assessment, wipe down, weighing, and measuring takes place shortly after the skin-to-skin contact and bonding time, or sooner if desired. Your baby will also have identification bands placed on his or her wrist and ankle right after birth, and a security alarm band. The security alarm band is connected to a security alert system for maximum protection. Every infant is also encouraged to receive a shot of vitamin K and erythromycin eye ointment as soon after birth. Mom will recover in the labor room for about 2 or 3 hours before being moved to the postpartum unit. If mom and baby need more time to recover, this time frame can be adjusted. If a cesarean birth is needed, there are 2 operating rooms on the unit. One support person is allowed in the operating room as long as the mom is not under general anesthesia. Once infant is born and both mom and baby are stable, skin-to-skin contact is encouraged with the assistance of a nurse. After the cesarean delivery is complete, mom and baby are taken back to the labor room to recover. You will be transferred to a postpartum room after delivery. After a vaginal delivery, the average stay in the postpartum unit is 1 to 2 days. The average stay is 2 to 4 days after cesarean delivery. These lengths of stay can vary based on the mother or baby's health status. All postpartum rooms have a bassinet at mom's bedside to provide rooming in to support our baby-friendly designation. Rooming in helps parents better understand their infant's feeding cues and care for their baby. During your postpartum stay, snacks and sandwiches are available for patients around the clock. Breakfast, lunch, and dinner are available for patients to order as well. Visitors are welcome to go to the hospital's cafeteria. The exact hours the cafeteria is open is on the menu at the bedside. While you are in postpartum, you can expect visits from the OB team caring for you, the pediatric team caring for your infant, and the nursing staff. If you are breastfeeding, your nurses are trained to help you with all of your breastfeeding needs. In addition, our lactation staff will visit you to help you with breastfeeding and answer all your questions. There are a few important requirements for discharge. The first one is a hearing screening and a PKU test. Both are required by the state of Illinois. The PKU test is a blood test that looks for several different diseases. Another test, called CCHD, screens for congenital heart disease. This test is performed by placing monitors on the baby. The first round of the hepatitis B vaccine series is also given before the newborn is discharged, upon the mother's consent. Pediatricians highly recommend getting the first dose within the first 2 days after birth. If you are planning on having your baby boy circumcised, this is something that is usually done the day after birth. The nursing staff must watch the surgical site for 2 hours after the procedure, so circumcision checks must be performed before going home. Our nursing staff checks all infant car seats for recall notices and safety issues before discharge, so please bring in your infant's car seat for them to look at as soon as you can. The pediatrician will want to see your baby for a follow-up well baby exam in the office 1 to 3 days after discharge. We hope you have found this tour helpful. Feel free to contact us if you have any further questions. Congratulations, and we look forward to seeing you soon.